Hey everyone, Dr. Dittman coming to you with our Myopia Matters video series. In today's Myopia Matters video, I want to discuss risk profile. And what that means is we are watching kids who are becoming myopic or nearsighted. And why we are watching them or treating them is we've realized that for years, by giving kids glasses and not slowing down the progression or their eye lengthening, we've actually not treated their myopia, we've treated the symptom of blurriness. So what we want to do now is actually take care of the kids who are actually progressing and getting worse and treat those eyes so they don't continue to get worse. So one of the things that parents will ask me or will discuss is, how do I determine if my kid needs to watch more closely? How do I know if my kid's more at risk? How do I know this kid needs more conscious follow-up, or do they just need checked once a year? And so what we did at Dittman Eye Care and the Myopia Matters Club is we formed a myopia risk profile. Today I'm going to talk about kids who are not nearsighted, and then in next week we'll talk about what we do or how we watch kids who are already nearsighted. So what this risk profile is we've looked at a bunch of studies and data to try to formulate a kind of almost a growth chart for myopia to see who is at risk to become highly nearsighted or more moderately nearsighted. And here are the risk factors we look at. So first, it's age. The younger your child becomes nearsighted, the higher risk they are to become highly nearsighted. So we look at 9 or less as that questionable factor. So if your kid's 6 or 7 and they're going to become nearsighted, they have a higher chance of becoming nearsighted than if they're 11, 12, or 13. So age is important. Ethnicity is very important too. So in Western PA in our offices, we don't have a ton of East Asian patients, so people from China, Japan, Korea, but people of East Asian descent have a much higher risk of becoming highly nearsighted. Where if they're Caucasian or other races or ethnicity, it doesn't have as much of a risk factor. So another thing we look at. Third thing we look at is refractive error, and that's probably the biggest one. So refractive error is a prescription. So if a kid's not nearsighted yet, but they're at a certain age and they're not as farsighted as they should be. So we're all born farsighted and we become less farsighted as we get older. But if a child is already less farsighted than they should be, this kid doesn't need glasses right now, they're seeing well, but that's a high risk factor for this child to become nearsighted and become nearsighted at a higher level. So those are numbers that our doctors look at, and we're actually checking this down and going over with parents. And we'll tell parents, your child does not need glasses at this point, but based on this number, they're already farther along than they should be, so we need to watch them more closely. Parents being nearsighted. So if both parents are nearsighted, there's a 6 times more likely chance your child will become nearsighted. If only one parent is nearsighted, it's a 3 times more likely chance. So is mom nearsighted, is dad nearsighted, or both? And then the things we talked about earlier is time outdoors. So less than 2 hours is our cutoff. So we try to get people out on average at least 2 hours per day or 14 hours per week. Difficult in Western PA in the winter, but we still need to try to make the most of the time we have it. And maybe it's more time in the summer and less time in the winter, and it averages out. And then the same thing about up close time. So anything more than 2 hours up close outside of school is a sign of concern. And if what we try to do is get children to decrease their reading screen time to less than 2 hours outside of schoolwork. And so what we do is we take all that information, we have point system, we formulate a point system, and then we go through the parent, tell them if they're high risk, low risk, moderate risk, and then we talk about a plan to follow them. So that's how we look at kids who aren't nearsighted, how we formulate who we should watch, who we shouldn't. Next week we're going to talk about kids that are already nearsighted. And the other thing that we're doing in our office, which is really important, is we actually have a way of monitoring and watching these kids, which I'll touch on in a future video. So I know this one was a little bit longer. I appreciate if you hung on for the whole thing. Stay tuned for more videos, and we actually are going to have something kind of as a free kind of giveaway. So if you're interested in this for your child, but you're not sure if you want to bring them in, stay tuned. We're going to actually be probably giving away some free virtual or Zoom consults each month for a parent if they want to talk with me about their child. It's going to be kind of a first come, first serve, and once we put that out there, whoever responds first will have that opportunity to spend maybe 10-15 minutes with me on a Zoom call where we can discuss their child and the risk of them becoming nearsighted and what we should do for them. So until next week, stay safe, stay healthy, and see you soon.